In this video, I'm going to tell you all about the blood test called NT-proBNP, which stands for N-terminal pro-B type natriuretic peptide. I'm going to call it NT-proBNP for the rest of this video. I will tell you exactly why we request this blood test and how we use it to make a diagnosis and guide subsequent treatment. If it's your first time here on my channel, welcome. My name is Hafiz and I'm a cardiologist training in London. I created this channel to increase awareness of heart disease and to tell you how you can improve your heart health. If that interests you, then click the subscribe button and the bell icon so you're up to date with all my videos. Okay, let's now get straight into the topic. NT-proBNP is a blood test used to measure the concentration of NT-proBNP in your blood. B-type natriuretic peptide, or BNP, is a hormone that is released by your heart when it is under stress. The hormone controls the volume of blood in your body by causing fluid and salt loss in the urine and causing your blood vessels to dilate. ProBNP is a precursor of BNP, and it is mainly released by your left ventricle, which is the muscular heart chamber responsible for pumping blood around your body. NT-proBNP blood test is requested if you have suspected heart failure. Heart failure is a condition where your heart is not pumping blood around your body as effectively as it should, leading to symptoms like breathlessness. I've done a whole video explaining heart failure in detail, so check it out later. Elevated concentrations of NT-proBNP levels support a diagnosis of heart failure and is useful for prognostication, which is judging how the condition will unfold over time. In general, the concentration of NT-proBNP increases as heart failure is more advanced. However, there are many other causes of an elevated NT-proBNP that might reduce its diagnostic accuracy for heart failure. These include increasing age, infection, kidney disease, and abnormal heart rhythms such as atrial fibrillation, to name a few. Certain medications like ACE inhibitors, diuretics, and beta blockers can also lower NT-proBNP levels, so all these things should be factored into clinical judgment when interpreting the result. NT-proBNP is usually measured in picograms per milliliter or nanograms per liter, and normal values vary based on age. The threshold will be determined by your hospital and the lab and dependent on units. If your NT-proBNP test result is above the threshold, you will need to have an echocardiogram, which is an ultrasound scan of your heart. I have also done a whole video explaining the echocardiogram in more detail. Conversely, if your NT-proBNP is normal, it can be a useful test to rule out heart failure. NT-proBNP isn't just for diagnosis, it can also be really helpful for monitoring heart failure. So it is not uncommon to check NT-proBNP levels again to see if you're responding to treatment. When you're established on treatment, the level will usually decrease and remain stable. So to summarize, NT-proBNP blood test is used to diagnose heart failure, monitor treatment progress, and help make a judgment on the likely trajectory of the condition. I hope that was helpful, and I'll see you in the next video.